Hello, Africa. You're welcome to ETV Ghana's African Women's Voices Show. This is the show that tackles issues pertaining to women as they contribute to national development. How have you been? It's WCW, and I am crashing on myself because I like the outfit that Parietal Styles has provided me with. I love it so much. Parietal Styles always costumes me and ensures that I look really beautiful, for you every Wednesday here at ETV Ghana. You can locate her simply by going on your social media page, Facebook or Instagram, and then you just type in afariwa.styles, and she's going to pop up, and you see a world of contemporary ladies and gents outfits. They've also got accessories that go with the outfit, and it's already made. So once you just pick whatever it is you want, you ask them to deliver it to you, and that's it. If you also want to visit them physically, they've got two shops. One is at Osu. The second one is along the Teshinungwa Road at the Rasta bus stop, okay, on the Rasta Road there. Container bus stop, you're going to find them there. Their phone number is also right now at the base of your screen, so try and give them a call either tonight or even tomorrow morning. Chana Shito is Ghana's #1 pepper sauce. So, we've been gifting and gifting this Easter, and it's still April. So you need to gift more. And next month also, that's the month of Mother's Day. And you'll be thinking of what to include in that hamper of yours. Include Chana Shito. It is the best of the best shito, I'm telling you. If you try Chana Shito, you will not try any other kind of shito again. We also have got our, ingredient that has been making Ghanaian jollof to be as tasty as ever. And that is leap tomato mix. So whatever kind of rice you want to prepare, it could be Ivorian, it could be American rice, it could be Chinese rice, Thai rice, any kind of rice at all. You need the secret ingredient, which is the leap tomato mix. With that, your jollof will be the best, all right? Okay, so my hair was put together by Awu's Hair, and you can find her simply on social media, and just type in Awu's Hair on Instagram and Facebook, or give her a call. For those of us women who hardly have time to be able to, go to the salon, she can always come over and get you done. If you just had a baby and you want to look good for the visitors, she will come and cater that for you as well. So reach out to her. Her number is also right now at the base of your screen. So we'll take you over to the 60 seconds update segment where we tell you what's happening with women here in Africa and across the world. And when we return, we get to meet with our guest who is poised and ready to take our questions on sickle cell disease. Do not go away. We will be right back.
Executive Officer of Vodafone Ghana, Patricia Obonai, has been enlisted amongst the top 100 women CEOs in Africa for her accomplishments as a female administrative officer in charge of the organization. The top 100 women CEOs in Africa is compiled by Research Global People in partnership with the SDGs Office at the Office of the President of Ghana and Advance Media. With the inaugural list announced in 2019, this publication throws the spotlight on African women leading various organizations across the continent. The list is also released ahead of the 2022-23 African Women CEO Summit to be hosted in Johannesburg, South Africa. Patricia's contribution to the telecommunications industry is unquestionable. In addition to championing various innovations in the industry, she is celebrated for her outstanding leadership during the heights of the pandemic. On Good Friday, an Easter convention at the Heaven Embassy Chapel was disrupted by 4 armed men who blocked 3 entries to the church auditorium. Over 70 people, mostly indigents of Etrima Afrancho, were held hostage for about 30 minutes as the robbers demanded their personal belongings. The Easter convention had brought many to the church for the first time in Etrima Afrancho Church. Injured Mamiama, a 10-year-old, has undergone a surgical operation to correct the injury on the leg sustained during the shootings. Reverend Newton explains she was shot in both legs. Her leg got broken. A bullet went through the leg. It was very dangerous. It took us a lot of courage to carry her to the hospital. We all thought the leg would be severed, he said. Her mother, a farmer, is forced to abandon her daily routine on the farm to cater for her distraught daughter, who is traumatized by the incident. Meanwhile, Etrima Kwanwoma District Police Command is investigating the incident. The traditional wedding of actress Rita Dominic and her fiancé Fidelis Anosike came off on Tuesday, April 19. The event took place in Owerri, Imo State, Nigeria. Rita Dominic took to her social media handles to share some photos and videos. She was spotted in a beautifully designed blue dress decorated with traditional beads. The event was attended by friends and family, which preceded by a star-studded bridal shower. Her husband is the founder of Folio Media Group, a multimedia company that owns Daily Times newspaper, Nigeria's oldest newspaper.
And you're welcome back to ETV Ghana's African Women's Voices show. So I mentioned that I was going to introduce you to our guest in the studio, and she's right here with me. Ladies and gentlemen, join me as we make welcome Dr. Mary Ekwa Ampoma. Well, her credentials are really, it's a lot, okay? And I'm going to be reading them to you as time goes on within the show so that you understand who it is that we are talking to. She is the CEO of Global Alliance of Sickle Cell Disease Organization, and in short, we call them the GASHTO. She's a lecturer at the School of Public Health, University of Allied. Okay, she's a lecturer at the Public Health University of Health and Allied Sciences, okay? So some of you call it UHAS, some call it UHAS, some call it OHAS, whichever way, just know that she is one of their lecturers there, and she's here to talk to us about everything that concerns sickle cell in just 1 hour. So we asked you earlier to send us your questions because she's not going to be able to cater for everything, but when your questions come through, it will help her to be able to give you at least some possible solutions, aside having to come see her for further directive. So you're welcome, Doctor.
Thank you.
Great. All right, so let's just kickstart into the show and let people understand a little bit about the overview of sickle cell. I know that we've talked a lot about this. You've been talking about it everywhere you've been, but I mean, we always have a new audience, so let's just let them know what it means to have sickle cell disease.
Okay, so I want to use this opportunity to thank ETV for this wonderful platform you've given me. And I want to thank all our audience and my students in UHAS. I know they are watching, and I'm grateful for this awesome platform.
Great.
Now, when we talk about sickle cell, I want to make it so simple, right? So sickle cell is when a person inherits, it is a blood disorder. So it is when a person inherits 2 abnormal hemoglobins, at least one of them being S. Now, I talk about abnormal hemoglobins because when you look at the blood, it looks red, right?
Yes.
Even if it's not, you haven't put it under the microscope. It looks reddish because of what we call hemoglobin. Hemoglobin is found in the red blood cells, right? Blood has red blood cells, white blood cells, and platelets, but sickle cell is as a result of the red blood cells. Now, these red blood cells looks oval so that it can squeeze itself in the veins and the arteries.
Okay.
And you have this hemoglobin in this red blood cell that picks oxygen. So, for instance, when we breathe in, oxygen moves into our lungs, then it finds itself into our hearts. It mixes up with the blood, then it's pumped to different parts of our bodies through the veins and arteries. Now, if you don't have sickle cell disease, your red blood cells looks oval. Okay, and when the hemoglobin in there picks oxygen and it gives off oxygen to the cells and tissues as it moves through the arteries and veins, it still maintains its oval shape after giving off the oxygen. Now, when somebody has sickle cell disease, what happens is that even though it looks oval, the red blood cells looks oval, when it picks oxygen and it gives off the oxygen, it doesn't come back to the oval shape anymore. Okay. It then looks sickled, harder. So it makes it a bit difficult for it to wind the cell through the arteries and the veins. Now, there's a school of thought that says that these abnormal hemoglobins, okay, so usually under normal circumstances, we have one normal hemoglobin, which is hemoglobin A, and everybody picks, we have a pair, everybody picks one from the mom, one from the dad. Now, there's a school of thought that says that some years back, maybe before Christ was even born, people were dying of malaria, so the body had its own way of protecting us so that when you get malaria, you don't die. So there was a change in the protein, in the hemoglobin. So that caused the different types of hemoglobin. So when we say abnormal hemoglobin, it's not the individual, but then it is the hemoglobin that the individual has. So for instance, we say that the normal hemoglobin is hemoglobin A, but then because of that change, we got other abnormal hemoglobins, which is hemoglobin S, C, D, E, F, all that. But then, so we say somebody has an abnormal somebody has sickle cell when the person has inherited these two abnormal hemoglobin with at least one of them being S. So for instance, if somebody is SS, the person has sickle cell. If somebody is SC, the person has sickle cell, SD, and all that. So at
AC?
least
The AC people?
No. So I will come back to that.
Okay.
So as I said that everybody picks one abnormal one hemoglobin from the dad, one hemoglobin from the mom. Now, there are a lot of people who have one normal hemoglobin and one abnormal hemoglobin. Okay. So we call them carriers, or people who have the traits. So for instance, if I'm AS, I have a normal hemoglobin, which is A. And I have an abnormal, which is S. So I am a carrier, but I don't have sickle cell. If I'm AC, one normal, one abnormal, so I am what? A carrier. Well. I don't have sickle cell. So we have a lot of people who are carriers. So in Ghana, we have about 27 to 30% of us. So if you take 100 people in a room, you have about 27 to 30 of them who are carriers, but they don't know because we don't do newborn screenings. And newborn screening is supposed to, because it is a genetic disease that you are born with, you are supposed to be diagnosed early. Everybody has to know their genotype, which is the kind of hemoglobin that you have.
From birth?
Yes, but because we don't screen. So for instance, when I visited the UK, when I was doing my PhD, I went there for experiential learning. And I went to a sickle cell clinic. And every baby born, everybody.
So it was like a norm. Once
they
you're just born,
screen for hemoglobinopathies, and sickle cell is part. But here in Ghana, we don't have a national newborn screening being done. It's now that we are doing pockets in different clinics. Okay, so Kolebu is doing newborn screening.
And that's based on request, or they just do it for you and it's part of the service?
So we have some partners, which is not government. We have some partners who are partnering and doing that.
Okay.
But what if the funding ends then? Because the first newborn screening was started in 1995, but when the funding ended, that was it. So if government was doing newborn screening, then it would have been national. Okay. So that everybody, when you are born, a baby, you know your genotype. So that as you grow, you know that, oh, I am a carrier. So when I'm marrying, you have enough knowledge, because awareness is good, because awareness guides your decision making. Yes. You have enough knowledge so that you'll be able to say, okay, I've met this person, the person is also a carrier. I don't want to marry because I don't want to give birth to sickle cell children. Or I will, but then I have enough knowledge to be able to handle it. So that is where we are. So when a child has sickle cell disease, when they are born, and for instance they are diagnosed, and we have about 50+ % of them dying very early because they are not diagnosed from childhood. Because when you are diagnosed, then because of infection, they will give you antibiotics and vaccination for you to survive. But in Africa, because we don't do newborn screening, these children die very early, and we lose about more than 50% of them before age 5. Okay, and globally we have about 24 million people living with sickle cell, and this 24, we have about 12 to 15% of them being in Africa alone. Right, and in Ghana we say that we have 15,000 newborn newborns every year, but that study was done in just Ashanti region, Kumasi. What about Accra, Greater Accra? What about the north? So if we do all that, we realize that we have more babies being born with sickle cell than we know. So the burden is huge. And these children have a lot of complications. We can talk about the clinical manifestation. Sickle cell affects every organ. And you have babies getting stroke because sickle cell affects the brain.
We will have to go for a quick commercial break. When we return, she's going to talk to us about how it manifests, how it affects various organs. You know what it means for a baby to have a stroke? Well, we'll find that out when we return. And you're welcome back to ETV Ghana's African Women's Voices show. We are discussing sickle cell. And before we went on the break, Doctor was talking about how sickle cell affects various organs in the body. And you find babies suffering a stroke condition. So she's going to tell us how that really happens. Do stay tuned.
So before I go there, let's talk about the pathophysiology. So initially I said that because of sickle cell, because of the abnormal hemoglobin, the red blood cell that is supposed to be oval lose sickles and hard. So under normal circumstances, red blood cells, the normal one with normal hemoglobin, lasts for 120 days and over. But then if it's sickled, because of sickle cell, it lasts less than 40 days. So every sickle cell patient is anemic.
Okay.
Because there's, they die, the red blood cells die off very quick, so they are anemic. That's one. Then two, there's rapid breakdown, so hemolysis. So, and also there's occlusion of the veins or arteries. That means these red blood cells that are sickled are not able to really wiggle its way through the veins that much, especially when they are cold. Okay, so it blocks where the joints are. So that causes pain, and that's where we get the sickle cell crisis, the pain as a result of that. So we have the occlusion. So these three factors, the anemia, the hemolysis, and the occlusion, can affect every organ. So we say sickle cell is a multi-organ, causes a multi-organ damage. Okay, so for instance, if you take the brain, it can affect the brain. So the blood moving through the arteries and veins in the brain can cause occlusion, okay, which prevents oxygen from getting to other places. So you have lesions being created in there because some of the neurons in the brain will not have oxygen. So it will manifest as infarcts, silent infarcts. Then we have the ones that when the blood comes and they are not able to move that man because of the occlusion, that vein will burst. So that will cause hemorrhage, and it can manifest as overt. Okay, so you see the person with physical deformity. But the ones that are silent, that one, the person looks okay. No paralysis, nothing. But cognitively, when you engage them, you realize that they have reasoning challenges, they have poor judgment, and sometimes their thinking too will not be there. Then they will have language challenges too. So some will have challenges with expression, expressive speech. So as I'm speaking, I'm not speaking because I have a mouth and a tongue, because there's a brain area called the Broca's area. that is able to help me express myself. So if that area is damaged, you have challenges expressing yourself. Then we have the Venicase, which helps you to understand what I'm saying. So if it is damaged, you have challenges there. And we have the loop. So we have the frontal loop, we have the temporal loop that controls memory. So for instance, if that place is damaged, you will not be able to really have memory for past or even new events in your life. So if you are young and you are studying, how are you able to study and memorize for you to recollect? So or recall. So these are some of the challenges. Then we can go to the parietal loop that is responsible for your spatial awareness. So for instance, it is responsible for you being able to even draw and make sure that patterns are, you see the patterns. There are some people who are not able to recognize patterns, and it's because of that.
The sickle cell.
No, not sickle cell, because of some of the manifestation of sickle cell. So that's the brain. But sickle cell also affects the eye, retinopathy. So we have people who weren't diagnosed early, but they were getting all the symptoms. But because of stigma, they didn't come to the clinic early. They came late in their 20s, and they have retinopathy. So it is the retinopathy that brought them.
Okay.
That's the eye. Sickle cell affect the teeth.
That's interesting. The brain one around the children is what is really amazing.
So you have 2-year-old suffering stroke, and that is the challenge. So why is it that they are not diagnosed early? Why is it that there's no national newborn screening so that a child in my village, okay, when born with sickle cell disease, they will be able to diagnose that child early, and they will start preventive care early so that that child will survive. And with proper care, proper comprehensive care, that child will have a good quality life and fulfill their calling or their potential so that they can contribute to global development. Why? Why is it that this is not done when we know that we have about 20 to 30% of the population who are carriers? They don't have sickle cell, but they are carriers, and they are intermarrying because they don't know. They are not screened. They don't know. So why is it that it's not done? I
can feel your passion, Doctor. So let's talk to our stakeholders right now.
Right.
One of our stakeholders, major stakeholder here, is maybe the Ministry of Health or the government, as the case may be. What will be the request we're going to be putting across to them right now concerning sickle cell?
For me, the first thing is newborn screening.
Newborn screening.
I mean, other partners are doing well. They are giving us pockets of. So now, in the past, before 95, there wasn't any screening. So Professor Hene Frempong, thank God for his life, he brought in the first newborn screening in Namin Kumasi. When the funding was over, that was it. Okay? And now, thank God, we are having pockets of it. So Kumasi is ongoing, Kolebu is ongoing. I know Rage too has started, even Hohoi have started. So they are doing a pockets. But what about a national one where it doesn't matter where you are born? You will still be screened. What about that? So that is where the challenge is. So let's take, for instance, those who are being screened, right?
Yes.
And you have sickle cell. You are born, you have sickle cell. What is the comprehensive care that is available for that child to really ensure that they have a good quality life? Because we have disease-modifying drugs. Hydroxyurea, which was the first disease-modifying drug that was developed, has been in existence for 30 plus years, right? But then if you look at some African, I am a global person, so I'm not limiting it to Ghana. So if you look at Africa, how many of the countries have made hydroxyurea accessible? Where it is accessible, it is other partners. So for instance, in Ghana, in 2019, Novartis gave us free hydroxyurea for 2 years. It ended somewhere 2021, October, thereabout. And I could feel the passion. Hydroxyurea is good. So if you are getting more crisis, which is preventing you from going to school, which is preventing you from living your normal life, going to work, which is preventing you from enjoying your social life, hydroxyurea comes in and reduces the crisis. So you will live a normal life. Then suddenly you had this drug free for 2 years. Then suddenly it is over, and government promised that it will be put on NHIS so that you can have access to it even after the free one. And here we are from October to this time. So I have children in Hohoi Municipal Hospital, because that's where I am. Hohoi Municipal Hospital. Sickle cell children who enjoyed, they didn't even start early. So they kind of enjoy for like 6-7 months, and now it is over and they can't afford. I have a few of them like that. So that child, some are 4 years, some are 5 years, some are 6 years. So they are now going back to their pain. I don't think it is fair. At all. I don't think it's fair.
Our major stakeholders, something
because
has to be
sickle
done
cell
about
is genetic, and government knows. Government can know how many children are born every year with sickle cell in Ghana. And I see other diseases being put on NHIS, and I'm like, what about sickle cell children? What about them? Don't we want them to live? Don't we want them to have a good quality life? Don't we want them to enjoy life? Don't we want them to fulfill their potential? Don't we want them to grow up to participate in global development?
We really do, and we would really be imploring the government to look into this situation, because if we have received it for 2 years from Novartis, that should have been enough time to start making plans around how to put on the NHIS as a promise was made. And as at now, since it ended around October last year, it still hasn't been transitioned into the NHIS, and it's not really the best. So we would implore the government to look into this situation to ensure that children or even adults who have been dependent on this Novartis would get access to it and live a better life. We'll go for another commercial break. When we return, I will be telling you much more about GASHDO and what they do around sickle cell. Do not go away. And you're welcome back to ETV Ghana's African Women's Voices show, where we are discussing sickle cell. We've gotten to the point where we are imploring government and other stakeholders to see to it that the hydroxyurea is accessible to anyone who needs it, so that people who are suffering from sickle cell disease will not have to be, going through episodes of pain and discomfort, and all those challenges that normally come with to people who are not taking the hydroxyurea. So today we have the CEO of GASHDO, and I'm sure a lot of us are still wondering, okay, what is this group all about, and why are they so interested in the sickle cell disease conversation? Let me give you a brief around them. So the Global Alliance of Sickle Cell Disease Organization is committed to ensuring universal access to appropriate management of SCD, advocating for policy change. So that's why she's asking for our stakeholders, including the government and other partners, to see to it that hydroxyurea is accessible to all the people who are suffering from the SDD. They're also looking at, policies that will positively impact the lives of patients. So GASHDO represents patients with SCD. So if you know any patient that has got SCD, you need to identify with the GASHDO, and they would help you, in what to do further. They also represent parents, carriers, and families of patients with SCD. They represent national and regional SCD organizations. They represent healthcare professionals, educators and advocates, community representatives, others not limited to individuals, organizations, institutions, including centers of excellence research and care provider organizations, and within the industry. So the vision of GASHDO is to reduce global incidence of sickle cell disease. So now we understand the reason why Doctor is really passionate about having to attack this right from birth. if we have children being diagnosed from birth, it's going to go a long way to reduce the incidence. So from what they are doing, they want to ensure equitable access to optimal care and treatment by all people with SCD worldwide. Their mission is to inspire hope and improve the quality of life of all people with SCD worldwide, with an objective to support access to disease-modifying innovative therapies, including clinical trials and research by all people with SCD, regardless of where they live in the world. GASHDO is organizing a global conference expected to gather key stakeholders to discuss the future of sickle cell care. So there's a conference coming on, and she's going to talk to us about this conference. You get it? And if you're somebody who is passionate about this SCD, or you've got a family member, you need to have the right information around the whole disease and what is happening and what GASHDO is doing about it. So I need you to sit closer to your TV set or to your phone or laptop or whatever means you're using to watch us tonight. Before she gets to the conference bit, she wants to talk to us about the psychological impact of SCD.
Psychosocial.
Psychosocial. Okay, so please, let's get that part.
Okay, so as I said, people living with sickle cell disease have clinical manifestations. That's what I've talked about. But there's also a psychosocial bit. So these psychosocial bit manifests as psychological challenges, because in our part of the world, I always compare those in the West with us, because their challenges are quite different from ours. Because of the financial burden, because you can't even live your normal life, because you don't have disease-modifying drugs, not to talk about cure. So people tend to be affected emotionally and psychologically. So it can manifest as depression, can manifest as anxiety because of the frequent complications, recurrent complications that you might be having. It can manifest as anxiety because you don't know when you would sort of die because of that particular complication. Then there's a huge burden of stigma.
Okay.
Because even if you haven't seen anybody living with sickle cell disease, if they should ask somebody, what do you know about sickle cell? The first thing they will say, oh, they die early. They are always sick, right? So there's a huge stigma. We have so negative narrations. We have this negative perception about people living with sickle cell disease, such that it sort of affect them and also affect the kind of support that we also give them. So for instance, if you have 4 kids and you have one living with sickle cell disease, a parent can say, oh, because you will die early, let me use the money to take care of you.
Why spend money to educate you when you're going to die anyway?
So there's this huge stigma. Some people even think they can't give birth.
Yeah, there's a question right here around it.
Yes.
A woman is concerned about childbearing.
I have people living with sickle cell disease that have 4 kids, 5 kids. It's just that they might have a high risk pregnancy, which is normal for any other, some conditions, right? So with proper care and support, they would have a normal delivery and have their babies. So there's nothing like they cannot have children, right? And also we tend to stigmatize them. We label them as sickless. So that's labeling alone. Sickler probably means somebody who is always sick. But
and
it
very
doesn't happen
weak.
that way. When somebody has malaria, the person falls sick, gets treatment, recovers. It is the same way. And I mean, if you have a condition, as I said to you, your genes also dictate the course of that illness. Okay, so we have sickle cell patients who don't even have much complications. They live their normal life. We have others too that have complications, and with proper care, as I said, with comprehensive care, they will live a normal life. Right. So we have this stigma. We have this stigma coming from the public because of low education. We are not educating the public that much. Because look at it. Just Kumasi, if you have 15,000 children being born, a year living with sickle cell disease. And we are not doing much education. We are not empowering the support groups, right? The sickle cell support groups to really educate patients and caregivers and also the general populace about sickle cell. Then where are we heading? Okay, so aside the stigma and the psychological, as I said, it impacts you such that you will not be able to work. And finding a job becomes a challenge, and even maintaining it, because if you have a job and you are not on any disease-modifying drug, so you are getting frequent crises, our employers are not that kind.
Yeah, it's not
And
a charity organization.
even if you are able to secure that job, even getting promotion, moving up becomes a challenge.
Yeah.
So that is where we are. And if you are a young child growing up, in terms of education, if you are getting frequent crises, you might not be able to go to school that frequently. So there should be some remedial intervention for you. But there's nothing like that, because at the top, there's no policy that is really looking at people living with sickle cell disease. So that is where we are in terms of, and also when we talk about healthcare disparity. I mean, when I compare, I remember the first time we met, 2019. I was the only person coming from Africa. Okay, so I had people from the U.S., Canada, Europe, Australia, and all everywhere. Middle East, I was the only one. And when we're talking about some of the issues surrounding sickle cell, I realized my narrative was so different, because I'm where I'm coming from, even getting access to hydroxyurea that has been in existence for more than 30 good years, it's even a challenge. Then, now, thank God that we have some coming from Novartis, we have some coming from GBT, but is it accessible?
That's the question.
If hydroxyurea that has been in existence for more than 30 years. So, but thank God that they are having clinical trials in Ghana. So if you want to participate, you can have access to it. Yes, but after that, can we afford? That is where government, good policies come in. Yes.
Great. So we'll go for our final commercial break. When we return, we will discuss the conference that Gashto is organizing. To stay. And you're welcome back to ETV Ghana's African Women's Voices show. I want to believe you've been able to have a better understanding of what sickle cell disease is all about. They are not people that can't live a normal life. They can live a normal life free of crisis, especially if they've got access to the hydroxyurea medication, which we are asking our stakeholders to get involved in to be able to make it easier for people to get this medication. And Gashto actually is doing a lot to ensure that stakeholders or even caregivers are empowered, institutions are empowered, and that brings us to the conversation around the conference that is coming on. She's going to be talking to us much more about what this conference is about and who is expected to be there and how this conference is going to help to alleviate the challenges that we are facing in the space of SCD.
So thank you so much. Let me use this opportunity to talk about Gashto.
Okay.
So the Global Alliance of Sickle Cell Disease Organization, our headquarters is in Canada, but I'm the CEO, and because of COVID, now you can be working anywhere.
Anywhere.
Yes, virtually. So the Gashto is sickle cell support groups. It's made up of sickle cell. So the Global Alliance of Sickle Cell Disease Organization is the umbrella for all sickle cell support groups in the world.
Okay.
Okay. So we are made up of member organizations. So we have membership, we have voting members who are representatives of each country. Sickle cell support group, that's the largest in each country. And we have non-voting voting members who can be sickle cell support groups anywhere who wants to collaborate with GASDO and be a member. So when it comes to GASDO, we are passionate about reducing the global incidence of sickle cell disease and ensuring what? Equitable access to management of sickle cell disease. So we do a lot, okay? So the key priorities for GASDO is education and awareness. When people have education, they are empowered. Mm-hmm. Okay, so for instance, GASDO wants to, we don't deal with the individual patient, but we deal with the support groups. How do we support them so that they can also support the patients and caregivers in their various countries? So we do a lot of education. We want to educate the community about what sickle cell disease is through our member organization. So we give them the platform, that global platform, for them to come and talk about sickle cell, what their challenges are, so that we can learn from each other. So for instance, I didn't know that in Tanzania, they've been able to give free hydroxyurea. They've put hydroxyurea on their NHIs.
Wow.
Yes, so if we are here and we are thinking it's not possible, an African country has done it. East Africa, they've done it. How can we learn from them? So that is what GASDO is about. We want to do a lot of education. That's why this conference is so important. So initially, we wanted to have it a hybrid.
Okay.
And it's because we have this, for us, it is historical. You know that in 2019, that was exactly 400 years the first slave ship left the shores of Ghana to Jamestown in Virginia, exactly 400 years. And there's this perception that sickle cell left the shores of Africa through slave trade, right? Mm-hmm. So we wanted to have this conference hybrid, come on site in Ghana and stream for those who will not be able to make it, right? For us to come back to where sickle cell left, okay? So we come back and see where we are. Where are we in terms of care? Is somebody having more resource than the other? How can we help each other? How can we ensure that it doesn't matter where any child is born in this world, they have access to care? They are diagnosed early, preventive measures are taken, and they have good quality life. Okay, so we wanted to come in, but COVID didn't allow, because then around February and January, the COVID rates went up. Mm-hmm. So we said, okay, let's do it virtual. So that's why we are doing it virtual. So we want to look at the future of care when it comes to sickle cell disease in what? A changing world, because COVID has changed everything. So what is it? What is it that we want to learn? What is it that we want the community to know about, the sickle cell community? What is it that we want our lawmakers to know? What is it that we want our patients to know? Everything about sickle cell, from crisis to psychosocial issues to mental challenges when it comes to living with sickle cell disease. So it is so important that everybody participates in this global conference. And this is the first time that patient sickle cell organization support groups are coming together. And they've lasted for more than a year, because usually when they are formed, within a year, it's done.
Okay.
But GASDO is in its third year.
And
we are moving.
Yeah.
And we are going to have the largest conference. And what is interesting is that we are going to, of course, when we look at the global community, we know that others have access to internet. So we've made provision for those who don't have access to internet. So for Ghana, we will go through the support groups in Ghana, have a place for patients and their caregivers to go and assemble and watch. That is beautiful. then we'll do the same for any other country that is a member of GASTO. So we will have others being in rooms watching what is going on, because we want them to learn. We want to educate. In the next 2, 3, 5 years, we'll have a lot of drugs.
Amen
when it comes to sickle cell, it will not be just hydroxyurea and the rest, the new ones that have come in from GBT, from Novartis, because there are a lot of clinical trials being done. Roche is doing one, Pharma, and others, Vertes, and others. And
so there is hope.
Yes, and we have cure too. We have stem cell transplants. Then we have gene therapy. So in the next 5 years, all these will be. Then we will have more, but we want to talk about access. Will we have access globally? That is where we are. So this conference is. I am already excited.
No, I can tell.
Yes,
because
even
of the way
I will
you're
be in
expressing
Ghana
it.
and participate, but I am already excited
about
and
it.
we are looking at patients, caregivers, we are looking at health professionals, we are looking at lawmakers, we are looking at public health practitioners, we are looking at everybody, the general public. Go and register, because we have open registration.
Yeah, so I was going to ask, so how do they get to register? They go to GASTO Facebook page?
Yes, and also go to our website.
Okay.
If you type GASTO and even put our website in there, it will just take you straight there.
All
okay.
right.
www.globalscd.org. www.globalscd.org will take you straight to our website.
Okay.
Go and register, participate, learn a lot, because you never know. You can help a relative, you can help a friend, you can help anybody. Get empowered, because knowledge is power.
Yeah.
And we say that the surest vaccine for the elimination of stigma is what? Knowledge.
Great.
So get empowered.
And on that knowledge note, we are going to be wrapping up tonight's conversation on SCD. If you need more on this, please ask on our Facebook page and we'll definitely reach out to her. But do not forget to go to their website to be able to register and participate.
And we have a
in the conference.
Facebook too.
We've got a Facebook page, and that's it's spelled GASCDO.
At Global SCD Orgs. So we
Okay.
have Instagram too, we have Twitter. So they should follow us there.
She really needs you to get this information and make sure you get it right. The good thing is that it's already on our Facebook page, so you could always refer to get it right.
I need a lot of support from Ghana, because I'm the first African to be CEO for more than a year.
Congratulations.
I'm the first, and I am not even I'm in Accra. I'm right in Hohoi.
Okay, so the repeat broadcast of this show will be brought to you on Saturday at 12 noon. And if you missed some portions, don't worry. Go to our Facebook page. You'll find it there. And also, it will be uploaded on our YouTube page tomorrow morning. So until we see you, do enjoy the rest of our interesting lineup for you. Bye-bye.
Bye.